area quite well, and that's why I'm so glad that he has come back home to our area, especially at this critical time. Well, let me say we are so honored to have our distinguished guests with us, all of you, Mayor Sanchez, Region 9 Administrative Commander Johns, and Health and Human Services Secretary, of course, Javier Becerra. Today's discussion on accessing mental and behavioral health services is so timely, and I'm particularly appreciative that we have the opportunity to focus on the unique experiences of Asian American Pacific Islanders, or AAPIs. AAPI constituents here in my district and Asian Americans across the country are at a very important point in our time because we are collectively grieving the tragic murder of 11 of our Monterey Park community members just a month ago. The mass carnage of Monterey Park came just after 3 years of increasing anti-Asian hate and violence, and the need for ensuring the accessibility of trauma-informed services is more important than ever. It's especially vital that we discuss the increasing need for mental health services for survivors of gun violence, including victim family members. When someone experiences gun violence, whether in a mass shooting or some other form of gun violence, the mental health effects are long-term and devastating. And while Monterey Park has joined the ever-growing list of communities impacted by mass shootings, we're learning that there are distinct cultural and linguistic challenges in how our communities are able to respond to these mental health needs. For example, while there are several state-level resources available for victims of crime, resources are offered in a limited number of languages, and the local agencies to which survivors are referred often do not offer linguistically or culturally appropriate services like counseling or grief support. Further, there is stigma in our communities about ever even discussing mental health needs, and so that keeps so many away from seeking the help that they need. So, while we need to think critically about public health responses after tragedy, we must also keep in mind that public health strategies to reduce the frequency of gun violence. Last year, President Biden signed into law the bipartisan Safer Communities Act, which provided funding for states and localities to implement proven strategies such as red flag laws, which allows family members to petition for removals of guns from a loved one's home when someone is a danger to themselves or others. This can work if it is utilized, but so many don't know about them, particularly our immigrant neighbors. Outreach on these red flag laws needs to be done in Mandarin, Cantonese, Vietnamese, and other languages so that we can all help in preventing these gun violence deaths. To ensure that this outreach happens here and nationwide, I am drafting legislation that will ensure the implementation of these prevention efforts and that they include robust in-language materials, outreach to limited English proficient and immigrant communities, and culturally competent education to community providers and law enforcement. This Congress, I will also reintroduce the my bill, the Stop Mental Health Stigma in Our Communities Act, which would provide grant funding for the Substance Abuse and Mental Health Administration, or SAMHSA, so that it can provide outreach and access to mental health resources for the AAPI community. And that includes those who are the direct victims of hate crimes. From encouraging members of our community to treat their mental health as seriously as they treat their physical health, to providing linguistically and culturally appropriate services from trusted providers who are already working in our community. There's so much that we can do to address the inequities AAPIs face in our mental health system. So that's why I'm so glad that we are having this critical discussion today. So let me introduce the ones that are around the table here.